In this episode,
It takes 4 to 5 mercury fillings in the mouth to have the same amount of mercury in your mouth that would contaminate an Olympic-sized pool. Think about that.
so
The mercury in 4 fillings, 4 average-sized mercury fillings, is enough for the EPA to shut down a pool, Olympic-sized pool, millions of liters of water,
Wow.
and treat it. There is a clear link to lower IQ in your children if you have fluoride exposure. No big difference in decay, lower IQ, and it's a neurotoxin. Who wants that? They used to ask me, why is it so expensive? Why don't you take my insurance? And I would tell them, I guarantee you that the insurance dentist makes more money than me. I promise you that. But my decisions are based on what you need, not what I can do for you that's paid for. Yeah, dental insurance versus health insurance, it's a joke.
yeah.
This is the entry portal, okay? Health starts in the mouth. It really does.
Hello and welcome to Health in Focus with Jacobus. I'm your host, Jacobus Hollowijn. I truly believe that where we are today in life is the subtotal of all the decisions that we have made ourselves, decisions that others have made for us because we were not able to make that decision. And then you add into that some unfortunate moments and very fortunate moments that have brought us to where we are. So when you look at that, my guest today is one of these people who has carved a way for himself to do what he's doing. He loves what he's doing, but certain decisions were made for him. Others, he was a victim of circumstances. And it all affected him in a way that he has become an incredible dentist. He graduated magna cum laude from the University of Southern California. He became a cosmetic dentist, and that turned into a biological dentist, which is a very interesting topic. He wrote a book, he created a product, he is talking to people, educating people, and he just enjoys his life in his field as well as with his family. Dr. Christian Hahn from Saddle Peak Dental is my guest today. Welcome to the program.
Oh, wow. Thank you so much, Jacobus. That's quite the intro. Yeah, I'm honored to have time with you. You have been a mentor in my life as well. You don't even know this.
Interesting.
Yes.
I did not know.
Yeah, your name has come up with many of my patients who've sought health and have found it through you. So thank you.
Ah, I'm flattered. I don't know sometimes how far how far your influence reaches.
Yeah, you know your circle of influence here in Bozeman is large, but it is a very small circle. So what you have taught in the healthcare industry has affected a lot of people, and they see me then to help them with things that cannot be fixed with either a diet or a supplement or a lifestyle change. So I dig into the oral cavity of the mouth.
Yeah, you bet.
And I repair the chronic inflammation that unfortunately cannot be addressed unless you remove them from the mouth. So that's kind of my expertise, you know. And
But your expertise grew out of an interesting event in your life. Tell us a little bit more about it.
So yeah, there's a lot to this this body
To where
here.
you are right now.
Yeah, I grew up in Germany, and when I was 11 years old, and I can't tell too many of the details, but I had a vaccination. And that vaccination resulted in me being hospitalized for 3 months.
So,
I
like
first,
you couldn't breathe, or you couldn't see, or what happened?
So immediately afterwards, I noticed my right knee became locked up. And I couldn't really move it. It was sore. The soreness then spread from my right knee to my left knee, to both joints. I became very tired. My mother took me to the doctor. They didn't know what it was. They thought maybe early onset rheumatoid arthritis. That's what they said.
Yeah.
And so it got so bad, I couldn't walk anymore, and I was hospitalized. I remember to this day taking a liquid amoxicillin every single day for 3 months.
Yeah.
I remember laying underneath too many x-rays. I remember every test you can imagine. I was hooked up to an IV on my hand for months, watching the drip, counting the drips. That's how boring it was. I lost over half my weight.
So,
I was what they called cachexic, and my school came to visit me. My mother slept in the room. We switched hospitals, and the conclusion was idiopathic. They don't know what it was. But I would never walk again. I certainly, if I did manage to walk, I would never do a sport. And there was a pretty good chance that this could be a short life, almost fatal.
interesting.
No solutions, no answers, no magic pills, no diet changes, no surgeries, no answers. And not one person mentioned the vaccines.
I was just going to ask that. Did any of your parents think about it?
Unfortunately, I believe no. I don't think anybody put it together until my history, my education as a biologic dentist, and my other experiences I had as well. I looked back and said, wow, look at that. The vaccine was just a couple of days before.
I see.
And then everything happened, and voila, that was my wake-up call. So the only thing that actually saved me was my mind. My mother gave me a gold necklace and said, this will make you better.
Huh.
And I do remember being in good spirits because nobody ever told me how bad it really was. So my family was supportive, the doctors were supportive, and I had a good attitude. And when I left the hospital in a wheelchair, and I was so excited to finally be able to move in a wheelchair because I was tied to an IV.
You still were?
I was tied to an IV.
Even in the wheelchair?
So as soon as they put me in the wheelchair, they took the IV out.
Oh.
They said, go home.
Wow.
And they told me, you're going to be using this wheelchair probably forever. My mother was crying. I was so excited that I could move. And so I was in the wheelchair, got home, and I got better.
How long did it take roughly to get better?
So 3 months in the hospital, it went pretty quick, because within a year I was a gymnast. Within a year I was doing giants on a high bar in gymnastics. I became somewhat of a prodigy in sports.
So,
which is completely contrary to
yeah,
what the
yeah.
doctor said.
Exactly.
And long story short, I became a elite level Olympic athlete in college in the United States when we
And
moved
you
here.
ended up going to the Olympics, or you were part of the
That was the next
program?
level. Yeah, that was the next level. I was one level before.
Big dedication, I'm sure.
Every single day, 4 or 5 hours in the gym.
Wow.
But this was completely contrary to what they said was going to happen.
Yeah.
And so that gave me the doubt. That gave me the spark that doctors don't know everything. And sometimes you need to look outside the box for solutions. Yeah.
Wow, dentistry. Why dentistry? What did you know somebody in the field and you were inspired by it? Or was there already a foresight that you had as far as there is something about dental health?
It's actually very interesting. I was going to be a computer programmer. I came from
Close
Germany.
enough.
Yeah, it's the same thing, right?
Yeah, you're
Very
German.
related. I was learning assembler language in German as I moved to the United States, and I really liked it. But my dad was a very well-known dentist. He practiced the highest level of dentistry at that time, which was gold. He did a lot of gold work. He did a lot of speaking on gold work. His dentistry truly was amazing.
Was it gold on the outside or gold on the inside, or what was it?
So USC, my school, is kind of known as one of the top gold schools in the world. Before we got into the biologic side of dentistry, gold was the best material. Still lasts the longest. Required the most skill. It's soft. It's malleable. There's just a lot of good things about gold in the mouth. So that was his forte. And I liked the lifestyle we had. I enjoyed the independence he had as a dentist. And so when it came to picking something after high school, I did graduate valedictorian, but I had no idea of what I wanted to do. So I said, well, I'm going to do dentistry because my dad has a great life. I'm good with my hands. And so I applied to dental school and, I got in after 2 years instead of 4 years. I kind of did everything a little faster. And there's a lot of interesting stories about dental school and how I became a biologic dentist.
I remember when I was young that when I was in elementary school, that twice a year there would be this dental bus that pulled up to the school.
Yeah.
And then everybody would have their own personal medical card that kept track of what we did when we had to go to dental. So you had to take that when your name came up, you had to walk out to the bus and then you go in. And I think there was 2 or 3 dental chairs in there with, I think now that they were probably dental students.
Well, we practiced on you.
Yeah, you sure did.
We should.
And I would get all these mercury fillings. And the way it was at the time, and it may still be when you were young, there was no Novocaine. You pretty much just drill when there was a hole. And if it hurt, it hurt. And it would go away pretty quickly.
Yeah.
But that's what they did. And then you come out of there and everybody was just, wetting their pants because it was so,
awful,
so
right?
intense. And you couldn't scream or anything. You just had to toughen it out. And my thought was always, when I got a little bit older, until I was 18, as far as I knew, going to the dentist, it would never do Novocaine. And I would look at that. I would always look at that light that shines in your mouth, and I would think about soldiers on the battlefield who would lose an arm or a leg, who probably had a lot more pain than a little bit of pain that I had in my mouth. So I just tried to encourage myself to just go through it. But when I came to the United States, I had 22 mercury fillings in my mouth.
Wow.
And I still ended up okay.
It takes 4 to 5 mercury fillings in the mouth to have the same amount of mercury in your mouth that would contaminate an Olympic-sized pool. Think about that.
So
The mercury in 4 fillings, 4 average-sized mercury fillings, is enough for the EPA to shut down a pool, Olympic-sized pool, millions of liters of water,
Wow.
and treat it.
Wow.
Yet you had many.
22 fillings.
So you have mercury poisoning,
Yeah.
clearly.
Oh boy, I should come
Yeah.
and see you.
Yeah, well, I think you're in the right track. So yeah, dental school. Yeah, in dental school we do use anesthetic now. Novocaine is a very common name, but we haven't used Novocaine since like the 60s. So it's Articaine, Lidocaine.
Maybe it was one of those.
Yeah, but we still use Novocaine because people know the name. It induces a great amount of fear. It's great.
Yeah.
The pain from dentistry. You are not imagining it. There's 3 pain nuclei in every single tooth compared to the rest of your body. So if you get a leg cut off, okay, you're going to have 1 pain nuclei. If I'm drilling on your tooth with a drill, you're going to feel dramatically more discomfort.
Okay.
So it's not people's imagination. It is horrible. And it's not just the pain, it's the sound, it's the vibration, it's the idea that somebody's in your mouth. And so I spent my career doing whatever I can to alleviate the traditional dental image. So the pain, the discomfort, I consider myself an anti-anxiety dentist, so to say. And if we work on a patient, it's not so much about getting the work done as it is doing it in a healthy way for the patient, not just physically, but also emotionally. So for kids, I take a lot of time. To me, it's more about them having a good experience because I have too many patients coming to me that say, oh, it was awful. I just can't. Dentistry is the nightmare from my childhood.
Yeah.
And we need to change that. But in dental school, here's an interesting story for you about mercury. I remember for 2 years, we were learning, right, how to place mercury fillings. We have a light right here, a big, heavy, bright light. We have fake teeth that we have collected, actually real teeth from oral surgeons that we set up in a cast that we drill on. So we drill on those teeth, and then we would take the mercury, the liquid part, and the powder, we'd mix it together, and then we'd plug it into those teeth.
Yeah.
So you have the plug right here, you have the heat right here, and I remember the mercury vapor coming up and feeling dizzy day after day because
Wow.
2 years.
Even with a mask in front of you, or you
We
didn't
didn't
do
wear
that at the
masks.
time?
Nobody told us to wear masks. The unfortunate position of most universities to this day is that mercury is not toxic. This is why in America we still use mercury. Warranting, Europe just banned it, right?
Yeah.
It's just we're in a litigious country, and if we suddenly change our stance on mercury, and we have billions of mercury fillings, can you imagine the class action lawsuits in this country? So
Yeah.
I feel it's a very difficult thing to call something toxic, even though everybody else in the world is. And I am pretty sure at the time I graduated from dental school, I was high in mercury toxicity.
So,
Yeah, and brain fog. It's just very, very sad what happens to all the dental students.
I just read an article in a magazine, and it was called The 17-Year Delay. And it talks about all this research that is going on currently in medicine and health by reputable labs and doctors and scientists. And once they prove that something is working or not working and the research is coming out, they actually shelve it for 17 years before they actually bring it to the public. So the knowledge about mercury, for example, that you're talking about may already be agreed upon, but they're not going to do anything
Well,
for 17 years before they start probably implementing it, because they cannot change the books every year. They probably have to pick and choose and say, if we're going to change these medical books, it's got to be done in a timely manner.
and they're going to introduce something else to change the priority, right? They're going to take the focus off of mercury, put it onto white fillings or something else, and then it slowly goes away. The problem slowly goes away. I mean, this is a playbook that's been going on with cigarettes, right? We know the whole story. The data was there. Doubt was introduced. Information became questionable. And then it slowly went away. People stopped smoking a little bit less. Cigarette companies bought food companies, and now they are, now they're doing the same thing for the foods. And now we're waking up with the foods. We're slowly starting to talk about food colorings. Oh, great, we took red out.
Yeah.
I mean, it's ridiculous. In the United States, things take a long time. You need to be an advocate for your own health. If you don't spend the time watching podcasts or YouTube channels like this, you are going to be unfortunately misled, because doctors don't necessarily mean harm. They just don't know any better. And it's a business. It's a business.
I agree. I agree. I do believe that, if we want to, on that topic then, I do believe that doctors, it's very difficult to be an independent physician at this point. Now, dental is different. I would say you can start your own office and start and do that. But medical doctors who see patients on a regular basis, for them to do all the bookkeeping and everything that is needed to thrive in the business, it's almost impossible financially anymore to do that. And you're going to be available 24 hours a day because you're like a country doctor. So most of them will go into a health center and then practice, and they say, well, these are the rules. And if you don't stick with the rules, you got to go. So they're somewhat forced, because I do believe that pretty much anybody graduating from medical school has somewhat of a brain and should be able to think for themselves.
They have good intentions. I think doctors, I mean, when you go into medicine, you start off with good intentions. You want to help people.
Yeah.
You follow the Hippocratic Oath. You want to be a doctor. You want to heal people. And then you quickly learn that it turns into a business.
Yeah.
And you have children, you have a mortgage, you have a life, and it is very repetitive, even in dentistry. You do the same thing over and over. I can't tell you how many times I've told people to brush more and floss more, and we know you don't.
Yeah, yeah.
Nothing's going to change. It becomes, after 27 years, it is a business, so you have to make a choice, right? What is it that you want to stand for in a legend kind of way when you retire? Did you run a great business? Did you own 25 practices, buy a private jet, and move on that way? Or did you focus on every single patient, not place toxic materials in people's mouths, not join organizations that are going to tell you what to do, not let insurances dictate the treatment? Patients ask me, they used to ask me, now people come to me because they know, but they used to ask me, why is it so expensive? Why don't you take my insurance? And I would tell them, I guarantee you that the insurance dentist makes more money than me. I promise you that. But my decisions are based on what you need, not what I can do for you that's paid for. If I was looking at your insurance benefits, I would dictate your treatment plan around insurance benefits.
Interesting.
And I would cut the time in half. I would move real fast. I would tell you your insurance covers it. You wouldn't question it. You would do it. And then after 10, 15, 20 years, you'd have a whole bunch of fillings. Then you would have some root canals, some crowns, some bridges. We pull some teeth. Eventually you get, partials or bridges or partials or implants. And then eventually maybe a denture. It is a cycle. And it's a wonderful cycle for the dentist. I always told patients a mercury filling, not a silver filling, it's more mercury. A mercury amalgam, or a silver filling as people like to call it, is a seed. I place the seed into your filling, into your mouth, into your tooth, and it expands and contracts 2 to 3 times. That's just the physics of mercury.
What do you mean it expands 2 to 3 times?
So when you drink a glass of cold water,
Yeah, it shrinks.
and then you drink a little bit of coffee, it expands and contracts. Everything does. The coefficient of expansion for mercury is 3 times as high as the outside layer of your tooth, the enamel. So your filling is doing this. What does that do to a crystal, which your tooth is? It's going to crack.
I see.
100% of the time. So every mercury filling will at some point cause a cracked tooth. A cracked tooth turns into either a crown, a cap, to hold the cracks together, more money for the dentist, or the tooth cracks in half, tooth comes out, now it's a bridge, 3 caps, 3 crowns, or an implant. It is a seed. I plant the seed, you water it with cold water and coffee for a couple of years, your tooth cracks, it gets into a bigger filling, then it turns into a crown or an onlay, something that goes over the tooth, more expensive. Then it turns into an extraction or a loss of the tooth. It's a wonderful sequence of events for the dentist. Every single tooth is worth tens of thousands of dollars in production for a dentist. And a lot of practices think of it like that. And so when I graduated from USC, I placed 1 amalgam, 1 silver mercury filling, because I had to.
Doing the exam.
For the board.
Yeah.
So I placed that filling on my brother.
Oh, is that right? Oh, that's
I'm
good.
sorry. I'm going to make it small. So I placed the mercury filling on him. And then the next day, he came back to the practice. I took the filling out, and I put in a composite resin filling, something that doesn't leach poison. It doesn't expand and contract to break the tooth. That was the last time I ever did what's called an amalgam filling.
So,
28 some odd years ago.
wow. That's really interesting.
So the funny thing is that
So so the knowledge was out there,
it just
but it
made
wasn't
sense,
practiced.
right? It just made sense to me.
Yeah.
You don't have to watch a lot of YouTube videos or seminars to have somebody tell you something is bad. You need to use your brain. You need to think. And if you know that something is going to cause something to crack because it's incompatible,
Yeah.
why would you use it? And we're not even talking about mercury toxicity. We're talking about something that doesn't work for teeth because it cracks teeth, right? So why would I place that in a patient's mouth when I can do something that is just as easy to place,
Yeah.
costs the same amount of money for the patient,
Is
looks
that right?
a lot better?
The same amount of money?
I would never charge different. If it's a 1 surface filling, it's a 1 surface filling.
Okay.
If it's gold, it costs more, right? Or porcelain. But if it's done in the office, it shouldn't cost more. It should be the same procedure. So why would I do mercury fillings? There was no reason.
I do want to ask you, and you said earlier about these 3 nerve endings or pathways. What did you use?
Pain nuclei.
Pain nuclei.
Yeah.
Now, when you were practicing and you were talking about these teeth that were in a form and you would drill, how do you know how deep to go before you would hit those pain receptors?
The pain nuclei, if you touch a tooth, you feel pain. If I blow cold air on your tooth, it hurts, right?
Correct.
Yeah. So there is a connection. See, it's an organ. Let's get that
It is.
right out. It's an organ. It's not a dead piece of tooth, as people like to think. It's an organ. It's alive. It has a lymph system, it has a nervous system, and it has a blood supply, a blood system. So
Wow.
all of those are circling to the tooth with millions of little tiny canals, and each canal is filled with a cell. Those canals go from the inside of the
The
tooth.
canals are filled with a cell.
Yeah, the canals go from
Yeah.
the inside like a nerve,
Okay.
like a
Yeah,
nerve arm,
okay.
right? So it goes from the inside to the outside, and inside that. So millions of them, miles of canals in your tooth. So those help you feel pain, hot, cold, and around the tooth is a ligament that makes you feel proprioception. And when you bite on something, you feel the tooth moving. That lets you know that you're biting together.
Yeah.
So it's a very complex organ. When that organ dies, meaning you cut the blood supply off on the bottom, no blood supply, it dies. So if I take your kidney and I clamp off the blood supply, the kidney
Correct.
dies.
Yeah, you
Liver
bet.
dies, right?
Yeah.
It all dies. So it's a organ with all this dead tissue inside. It's got dead cells, millions of them. It's got connection from the outside of the mouth, where you chew, where all the bacteria is, to the inside of the mouth through millions of little canals.
Correct.
It's a connection.
Correct.
And all that stuff rots. When something rots, okay, it is bacteria food.
You bet.
Bacteria food
You bet.
is a bad thing, right? Bacteria release metabolites or toxins, and those things poison you. We'll get into that in a little bit more detail.
Yeah, because if the temperature of the mouth has a certain temperature, that will,
yeah.
will accelerates it.
It's the best place for bacteria to grow.
Yeah.
And they grow wherever they can. They hide, right? They want to hide from your immune system. If you were to hide from the immune system, where would you go? You go in a dead organ that has an endless food supply that cannot be reached by your immune system because it's outside the body, yet in the body at the same time.
Correct.
And around it is a ligament that now is also dying, and below it is a opening that used to be a connection into the main blood supply that now is also dead, and gravity pulls all that poison, just drips right down the bottom, out into the bottom of the tooth, into your bone, from your bone into your system. So in a way, it's leaky gut at its worst.
So, wow, that makes a lot of sense.
Now, there's
when
only,
you say it that way.
Yeah, I mean, people know when from the mouth to the bottom, it's a tube. It's a sealed tube. We need to keep the outside and the inside inside. When there is a break in that tube and the bad stuff gets into your body, it's called leaky gut.
Yeah,
So people
correct.
know leaky gut from their stomach.
Yeah, you bet.
They know that that's bad, right? There's so many different diets to try to repair the leaky gut.
Amazing, yeah.
But in
And
reality,
it is a cause of autoimmune diseases.
absolutely,
Yeah.
absolutely.
Yeah, I mean the leaky gut. So
Leaky
it's
gut
interesting
is.
that you now talk about the teeth.
Leaky gut starts right here.
Yeah.
So your teeth, if there's bleeding when you floss, okay, that is a direct connection from the outside to the inside, leaky gut. So periodontal disease, gum disease, leaky gut. Wisdom teeth that are infected, that are connected to the inside of the mouth, leaky gut. Root canals that are infected, leaky gut. When you have a deep pocket, right,
Correct.
5 millimeters, we like to say, that's because that's where the bad bacteria live. And as soon as you put your little instrument in that pocket around the tooth and it bleeds, now you have leaky gut and the worst bacteria getting into your system all the time. In dentistry, we protect ourselves by giving antibiotics, legal protection. Because if somebody has gum disease, or if they have a heart valve problem, or they had a knee replacement, we don't want the bad bacteria from your mouth getting into your system and then colonizing those parts of your body.
Yeah.
Right? So theoretically, and this has been a little bit adjusted over the last couple of years because it was ridiculous, when you give somebody antibiotics, they are now protected for a short amount of time from bacteria getting into their system. So when I work on you for 20 some odd years, the rule was give them an hour before a prebiotic, an antibiotic before treatment. Why is that? Because if anything happens, it's not my fault.
I see.
Because I was giving you antibiotics. The
Correct.
funny part is you're going to go home, you're going to brush your teeth, bleeding. You're going to floss, bleeding. You're going to have gum disease, bleeding. You're constantly leaching bacteria into your system all day long. It's not my fault.
No.
I'm just protecting myself legally from you saying it was me.
Plus, antibiotics are very limited in what they can do.
Absolutely.
They
that's a whole
don't deal
nother
with
subject, yeah.
fungi. They don't deal with viruses or parasites. they're just antibiotics. And I always say it is the shotgun approach that medicine is using for almost everything. Because you don't want to tell somebody, well, I'm going to use an antiparasitic medication on you. The people freak out. Antibiotics is like this common household word that
expect it.
everybody expects and accepts.
Yeah,
Yeah.
and it's a psychological aspect as well. If I don't give antibiotics and somebody expects it,
Yeah.
it's my fault.
Yeah.
You know, if anything happens, it's going to be. So often we prescribe antibiotics just because you expect it, which is stupid. Literally. Because antibiotics, we know the studies, right? One round of antibiotics increases your chance of anxiety, loneliness, depression by over 20%
I
for
did
12
not know
months.
that. Wow, that's
Over
interesting.
20%. And that's one round.
Huh.
The second round bumps that over 50%. So you wonder why people feel lonely, and they're always on social media trying to connect, right? People watch YouTube, they watch social media. Number one, because they're bored and because they're lonely. So this has a lot to do with the drugs we're giving them that are destroying their ability to recognize self. So when you give them antibiotics, they're going to feel anxiety. Anxiety is huge, right? They're going to feel loneliness, depression. Then we give them more antibiotics. Then we give them, SSRIs. We give them drugs to make them feel better,
Exactly.
which are made in your gut, right? 70% of your
Naturally,
serotonin is made in
yes.
your gut.
Yeah,
We destroy the gut bacteria that makes the happy hormones.
Yeah.
You feel depressed, anxiety. We give you a supplement so that you no longer build it yourself. You let your gut be destroyed. You can no longer take care of your own chemistry, so to say. And no wonder people are all messed up. And it starts with just one round of antibiotics. And so,
That's incredible.
and that's just one drug.
Yeah,
There's
that's really
just
something.
millions of them out that do worse.
Yeah, and you look at so many young children that get on antibiotics
Ear
for whatever
infections,
reason. Yes.
tubes.
Yeah,
Well,
and so they already start behind the eight ball simply because of a treatment like that.
You are born with, I think, 287 toxic chemicals in your umbilical cord. Okay,
Huh.
so you're born with all those toxins because of the environment the mother lived in. So you are born toxic.
But they start helping you to build your immune system.
Well, these are not natural toxins.
Okay.
These are the chemical toxins.
Okay.
The things that you don't want in your body, the things that shouldn't be in a human body at all.
Okay, that's what you're talking about.
Glyphosate, things like that. But so the child is born toxic, and then it gets vitamin K, which it shouldn't have because vitamin K, I mean, it's a whole other thing. You shouldn't be using vitamin K. Your body has so many injuries from going through the birth canal. The blood needs to flow. It needs to flow to all these areas to heal. If you're going to clot it up, now the body can't heal, right? Baby can't heal. You clamp the umbilical cord, which has a significant portion of the baby's blood. It's not your blood. Baby needs that blood. Let it get into the child until it stops pulsating. You leave the umbilical cord on. I mean, there's so many things we do wrong for children that by the time they see me, they say 3 years of age, you should look at a child, right? By the time they see me, they have jaw development issues, right? Because they didn't breastfeed long enough. They didn't have the proper diet. They're all eating out of these little pouches.
Yeah, the liquid pouches.
So they have jaws don't get developed, so they don't have airway issues already. And then we got to talk about
They have
airway
suction
dentistry.
power, but they don't have
Exactly.
biting power.
And then they have habits. They push the palate up, so you get these vaulted palates with kids. And so you are starting off on the wrong foot. And then you get all these vaccines. I don't even want to get started with that. You don't. I mean, let a human being be a human being. So by the time the person is a teenager, it's a miracle we're alive at all.
Let me ask you then. I mean, I don't want to dive totally into vaccines, but you are in the medical field. You have experienced it. Because of that, it has given you a lot of interest, and I'm sure you've read about it. So, what is your worry about vaccines as a human being, but also as a physician?
So, such an interesting
I mean,
subject.
is it the multitude, or is it all the additives? Is it, is
It's
it like
all of
we're
it.
looking for something, we're looking, well, why don't we just create a vaccine for it and just add it to the program? It worries me. I mean, I didn't grow up like that. And
So-
I have read too much, but I wanted to know what you as a doctor
I'm of the opinion
have
we don't need
noticed.
vaccines. I'm a believer that the human body was designed perfect and should be allowed to develop natural immunity. So if we look at this, if we look at the VAERS studies, just on the more common vaccines, and let's use measles because it's everywhere right now, MMR vaccine. If you are able to, and you can, look up the VAERS studies of the 1% of things that are reported to VAERS, right? VAERS is reported at 1%. You look at the mortality rates and the major injury rates of the vaccine, the MMR vaccine, and you compare that to the mortality rates of actually getting measles. Don't quote me on the exact numbers, but it's something like you're 12,000 times more likely to die from the vaccine. And that's just one number, okay? If you account for all the actual numbers in VAERS. So there is no need, in my opinion, to get a vaccine. I think if we look at the study that just came out, right, they've been trying to hide the study, the 16-year study on vaccines that just came out, comparing unvaccinated children to vaccinated children, done by a pro-vax individual.
Interesting.
It's called, it's an inconvenient study is the documentary.
Okay.
If you look at that study, you will see that every single number with regards to health and chronic disease is in disfavor for the vaccinated by a 4 to 5x
Wow.
increase. And this is a study that's a retroactive study of 16 years. You can't make that stuff up.
No, of course not.
He didn't want to publish a study. He said he was going to publish the study, didn't want to publish the study. They had to go under microphone, hidden microphone, to get the information from this doctor in a state where that was legal to get the truth, which then was published in the documentary. So
this is the doctor who was the
Who did the
pro-vax
study.
doctor who did the study.
they wanted. He said, "I'm going to study it." He said, "This is so dramatically bad for the industry, for the vaccine industry, that we cannot publish it." So things like that. Plus personal experience. My aunt got the polio vaccine when she was 7,
Yeah.
and she became crippled. She's had every joint replaced multiple times. She can't move. She can't move anything. Literally, she's alive and doing well, but she got a MS polio version from the vaccine. So that happened to a lot of people.
Yeah, yeah. I know somebody, a dear family friend, who is a few years older than I am, who, as long as I've known him, has always had a limp. One leg is shorter than the other, and his hand is spastic, and he got that from the polio vaccine.
And then you look at the newest wonderful, vaccine. Look at all the studies coming out now from the COVID disaster. Can't even discuss that.
That is the sad thing. In a country where freedom of speech is so promoted, you cannot use the C word. You
No, we
can
can't.
use the cancel word. You
Nobody's
cannot
going to
use
see
the
this
COVID.
podcast or this vlog if we use those words.
Exactly.
Because they don't want the truth out
it
there.
gets flagged. And it shouldn't be that way. Not in this country.
No, but
because it's just information. There are people who will hear you talk about it, me talk about it, and will say, okay, I'm going to push the button right here. I'm not going to watch the rest because these people are clearly streaming against me. And that's not what we want. We want people to know, and we're open to hear other people's opinions.
We want the opposite. We are pro-humanity. We're pro-health.
Yeah.
All we do, if you go into the medical field as a dentist or a doctor or as a, even an information blogger, which is very, very important these days, you want people to be healthier. All we do is we're not trying to make money off of this. We're trying to help people make the best decisions for their health. So for the last 5 years, when I look at somebody's mouth, and this is clinical data, this is something that I can say because I'm a full-time dentist. I look at your mouth. I can, within seconds, I know if you got the vaccine, the more recent one, within seconds. And I've never seen such unhealthy gums so early on in life for children. And if you don't get mad that this is happening to humanity, you cannot be my friend. Just sorry, but if you don't see that this is doing so much harm to the population, in my opinion, on purpose, then we don't have much to talk about. We're not going to talk sports in your favorite team or your business if this is something you're okay with. Because when I see inflammation around every single tooth, on the, I call it the end point capillary system, right? Where the blood flows and then it turns around and it comes back.
Yeah.
That last little turn where you have the smallest blood vessels, the capillaries,
Yeah.
those are all inflamed because the blood is thick and clogged and the red blood cells stick together and you have chronic inflammation of your vascular system, okay? When you see that on nearly every single patient who became part of that experiment.
Now you're talking about vaccines in general,
No,
or
just the last
COVID
one.
vaccine?
Just the COVID one.
Okay.
If you see that, and why would I, as a doctor, not point that out or notice that? Why would I have to even be concerned about mentioning that to somebody, right? Why should there be a threat by the system of a dentist observing these things and raising a little bit of a red flag? Hey, I noticed that every single person who's had this vaccination, day one, 3 years later, still has the same major inflammation of their gums. Bleedy gums equals, direct connection to your system, leaky gut. Everybody.
Are
Why would
these
I?
also patients of yours who themselves are in the dental chair and say, I've been having a lot of dental pain or gum pain, or often they don't even feel the pain, but you can see the inflammation?
They don't feel it. No,
Huh?
they're unaware.
They're unaware.
They're
Huh?
unaware. They have other issues, right? Because other issues take precedence. When your body starts to fail due to chronic inflammation is the root cause of nearly all disease.
Yeah, absolutely.
So if your body starts to fail, and everybody's different, is it your vascular system? Is it your brain? Is it, is it cancer? Something in
Yeah.
your body is going to take advantage of your immune system being completely exhausted due to
Correct.
chronic inflammation.
Correct.
Whatever that is, that's your priority. It's not your bleedy gums. Your bleedy gums are just
Just a
telling
symptom.
me
Yeah.
is that you're screwed. You have something going on.
Yeah.
And I haven't found a solution to fixing the cause, but I have found through people like you as well ways of treating it, right? McCullough protocols, things like that. There's ways of treating the symptoms. It's like we're almost being pushed into allopathic medicine because we can't reverse a DNA change.
Yeah. The
And-
McCullough, you say McCullough
McCullough protocol is-
and that
is-
is the bromelain and the nattokinase.
It's
and the,
always changing, yeah, but that's...
Oh, it is changing,
Yeah, because
okay.
he has a nice website, and they're doing research all the time, which is great.
Yeah.
And they're always changing it, and they're always updating it because research is actually coming up now, right?
Yeah.
They just put a black label on it, a black box label, which is like, you can die from this. Great. Why would I take that if I can die from it?
Wow.
5 years later, we knew this, and it's frustrating because a lot of good people that I know chose to go along with that, and several of them that I know, including my mother, already passed away from it. My father almost passed away from it, stage 4 colon cancer.
Yeah.
6 months after, that's like the timeline. He did survive, thanks to European care. I think it's a little bit better personally. European medical care is stronger in my opinion. But yeah, it's very frustrating. So I don't even say anything anymore. When I see a patient, I'm here to help them get better. And if I don't know a way to help them, I'm certainly not going to worry them. I'm not going to tell, you have this, it's never going to go away. It's only going to get worse, and something is going to get you sooner rather than later. That's not how a biologic dentist handles situations.
Now, during COVID, many people were told that when you stay in close contact with people who have had the shot, that you could be affected as well. You could get that spike protein. Is that also, therefore, you see that in the mouth of people who never had the shot, but who have been surrounded by family members or spouses?
It's a really good point, Jacob. This is the main confusion they are on purpose introducing. People like me, like most biologic dentists, Dr. McCullough, we've been fed so many different reasons for what is going on that they're creating confusion. They're creating confusion. And so there's things like The Invisible Rainbow, right? A wonderful book on EMF. I feel EMF is probably the root cause of everything. Then there is the books on the truth of viruses, right? There's many. Virus Mania is one that I like. But
Virus mania.
Virus mania, yeah. So we can't prove the existence of a virus no matter how hard we try.
Okay.
We can't, there's been studies
I
done
thought
where,
that viruses are part of life.
yeah, well, virus is something that they define as whatever it may be, and
Yeah.
that it's bad. It may not even be bad. It could be DNA fragments floating in the air.
Yeah, you bet.
But when I have the flu, I can't get you sick. There's been studies showing that I cannot transmit the flu from me to you. That's been impossible. So that doesn't go along with the the contagion theory, which
Yeah.
is another good book. So the problem is that we don't really know exactly what it is. But here's the facts. When I worked on patients in Atlanta, Georgia, when I worked 4 days a week after the COVID adventure, by the end of the fourth day, I would have bloody noses.
No way.
Bloody noses.
Wow.
And that's never happened before.
Huh.
I would take a week off, no bloody noses. It's only when I worked on all these patients. So what does that mean, right? Is shedding real? It seems like whatever it is that is being transmitted to the person is real, because it's exhibited in me getting bloody noses all the time.
Right.
So what is that? Is it EMF?
Were you
Is it
also
shedding?
more exhausted at the end of 4
Gosh, I don't work that
days?
hard.
What's that?
I don't work that hard.
Okay, well, I thought
I take my time
maybe
and-
the effect was also, like you mentioned, inhaling the mercury really made you dizzy.
Oh gosh, no, we take extreme precautions as biological dentists. We'll talk about that in a second.
Yeah, okay.
Yeah, we don't do mercury vapor at all. I don't cut mercury. I cut around the mercury. So we never actually create mercury vapor anymore.
Right. Okay.
But no, 27 years of doing it, and only the last 4 years when I work 4 days a week on patients caused this problem. And so shedding, whatever that may be, in my experience, is real. And I see it here as well. I just only work 3 days a week on purpose. And then I detox and I eat a certain way, and I try to create a very resistant body, a very strong human body. I think what we really end up needing to do is to prevent a weak immune system. We got to prevent chronic inflammation. We got to prevent toxicity that we're surrounded by. The air toxicity, the water toxicity, the food toxicity, the mental toxicity of negativity and people. So if we create the strongest human being that you can be, and this is what I teach now, that is really the best way to live the longest, healthiest life, right? Health span, not lifespan.
Yeah.
So
Correct.
3 days a week for me as a dentist is it, on purpose, because it's all I can take in toxic-wise, and then I consistently, gently detox it, and then I focus on a very strong, positive mental attitude. So I'm a hopeless optimist. I think that's very, very important in life. And most people who come see a dentist are very depressed, sad, unhappy, frustrated, and we as professionals internalize that. We become part of that negative energy. And that does affect you after 27 years of somebody saying that, sorry, doc, it's nothing personal. I just hate coming to the dentist. I hate seeing you. This is the last place I wanted to be.
Yeah.
Now that affects people, in a very negative mindset wise. And when your mindset is broken or compromised, everything else starts to fail.
Yeah.
So we build the mindset. We detox the waters, right? We drink healthy water. We detox the air. We avoid EMF. We eat a certain food and a certain diet and a certain protocol that I created to try to create the strongest human being you can. And then you can be around bad energy. You can be around toxic people. You can be around EMF for certain periods of time without getting sick.
I heard once that dentists are the ones who die sooner than most other physicians.
True.
That dentists retire earlier than most other physicians. That it affects their brain, like you mentioned, the positive thinking versus the negative feedback you get a lot. And you know that certain procedures hurt, and so audible hurt afterwards. But is there a truth to that? That dentists are suffering more from it? Or do you feel since the introduction of the zirconia fillings that some of that has been diminished?
So all of it's kind of interesting subject. So we do have high suicide rates. We don't have the highest anymore. It is a very challenging environment to be around for any human being. So you have to create an environment as a dentist in your practice that is uplifting to you.
Correct.
I have a good time in my practice. I laugh with my patients. I don't do stress. I don't do stress for them or me. If I don't work well with staff, then we get people who can work well with us. I only work as much as I can to enjoy what I do. And I don't work on patients. I don't cause pain. If you're not comfortable, if you're not numb, we don't work on you. There's things you have to do to make dentistry as enjoyable as possible. Secondly, we don't use toxic materials. I haven't used toxic materials ever in my practice. So we don't use mercury. We use certain types of plastic fillings that are filled with zirconia instead of plastic, right? We use the healthiest materials that you can find, constantly changing. We use a lot of protection. We use suction machines for removing mercury. We isolate the tooth with rubber shields when we do mercury filling removal. We don't expose the patient or us to mercury vapor. We don't do root canals. We don't use metal.
Why do you smile when you say we don't do root canals?
Oh, because I get attacked about root canals all the time.
You get attacked?
Oh my gosh, yes.
What do you mean attacked? By patients or by professional, other colleagues?
Endodontists, colleagues. Well, the root canal industry is huge. It's huge. It is a multi-billion-dollar industry, and the endodontists are so powerful. When you bring out a documentary,
An endodontist is somebody
a
who does
root canal
canals.
specialist. Yes.
Okay.
So you bring out a documentary on Netflix called, The Root Cause.
Huh.
Right, it was called The Root Cause. It was a great documentary. They were able to get it off within a month.
Wow.
Yeah, they were able to get it off within a month. And
You mean get it off?
get off Netflix. You have
get
a
it
hard
off
time-
Netflix.
Get it off Netflix.
Oh,
within a
I thought
month.
that it took them a month to make it. That's
No,
how good
no.
it was.
The documentary is a great documentary.
Yeah, okay.
It's a wonderful documentary. But the endodontists, the root canal specialists, were so upset they got that thing taken off within a month. And so now, when anybody mentions anything about root canals possibly being bad, and I'll give you a really good example in a second. Number one, you're going to be on a list. Okay, you're going to be shadow banned on social media. You're going to receive nasty messages on DMs or on comments, and possible litigation. I mean, Hal Huggins destroyed, right? You know how that whole goes.
Interesting.
So here's a good example why this doesn't sit so well with me. And I have endodontists who are amazing people, good friends of mine. I just don't agree with what they do. In the mouth, there is something called the focal infection theory. You've probably heard of that. That means that if you have an infection somewhere in the body, bacteria, it can travel to a different site in the body, right?
Yeah.
Like taking a ride in your bloodstream and affecting a different part.
Yeah.
So if you have a knee replacement in the body, and I am going to work on you as a dentist, there is a link to the bacteria in your mouth somehow getting from the mouth to your knee. And so we were supposed to give you antibiotics when we work on you to prevent this bacteria getting into your system and traveling to the knee.
And
Focal
thereby
infection theory.
rejecting the... Oh, okay.
Yeah, just living around the knee causing an infection.
Yeah.
So that's called the focal infection theory. The infections in your mouth, gum disease, whatever they may call it, travels to clearly to your heart valves.
Everything goes to the heart.
Clearly to your organs, to your brain, to your joint replacements. All that has been proven. The endodontists, the root canal specialists, vehemently deny that any bacteria that could be part of that root canal leaves that root canal ever and travels anywhere else. There's the focal infection theory doesn't exist for root canals. They're like exempt. Root canals are exempt from the focal infection theory, but everything else in the body is affected by the mouth. So does that make sense?
No.
Is that like maybe you're trying to protect your profession in sacrifice of the patient?
Yeah.
It doesn't sit well with me. I can't subscribe to that. Okay. When I see massive infections around roots, dead roots, root canal teeth, massive infections, patients come in with incredible health issues that get resolved when I remove those infections.
So
Not by redoing the root canal, not by giving them antibiotics, but by removing the source, the dead organ. And they get better. Okay. I had a patient last year. I did a video on her.
Oh.
And she let me publish everything. She came in, she had major issues in her life. She was borderline considering ending her life.
So
Because of all this. She had acne, terrible cystic acne on her face. Tried everything. She did the Pomka protocol. She did everything she could.
Dr. Pompa?
Yeah. He's a great detox protocol.
Yeah.
She did protocols like his. She did all the skincare you can imagine. Nothing was getting better. She's seen dentists. Everything looks fine. Everything looks fine.
So she
comes to
was
see me.
already aware. She thought there could be a connection with my teeth.
There was a
But she
naturopath
was,
that told her. A naturopath told her to see me here in town.
Yeah.
She didn't really connect the mouth issues until she said she looked at the root canal teeth and saw purple or bleedy purple gums around them, which is very common. And to her, that was a warning sign. To the dentist she was seeing at the time, it was normal. They didn't take what's called a 3D or a CBCT scan, like a CT scan of the head. So she was referred to me. And the first thing we do, of course, we listen to her. You're not crazy. Something is wrong. Then we do a CBCT or a 3D scan to look at all different angles of all the teeth. Her infections were some of the largest I've seen on her 2 teeth that were root canaled. No other dentist found them. They took simple 2-dimensional x-rays, and sometimes it doesn't show up on those x-rays. Okay? So she was told, it's fine, it's fine, it's fine. I look at it. Some of the worst I've seen. Long story short, we end up removing those teeth biologically. When the tooth came out, immediately she started to weep. She cried. She said she felt her body release the toxins. And I've had this happen many times. It sounds strange, but you feel the relief. Your body feels the release of the poison.
Oh.
And it's an emotional release. Within a week, her acne started to go away. Within a month, no acne.
Huh.
Her mental health, she had difficulties thinking, major brain fog. Everything started to clear up. Her entire life changed. So it's a really interesting story. And it's not an isolated story. This is something that happens all the time. So that is real world experience.
You say biologically extracting a tooth. What does that mean? What is that? How is that different than extracting a tooth?
So let's talk
What
about
do you do biologically extracting it?
what's a biologic dentist, right? What's a holistic dentist? What's the difference? In an ideal world, every dentist is a biologic dentist. Do no harm, a holistic dentist. Don't put poisons in the mouth. Listen to common sense research. Put the patient first.
Yeah.
Biologic dentistry, biomimetic dentistry.
And I would
all the
also,
same.
if I can add then to it, it would also be that the mouth is part of the whole body. And so when the mouth is affected, parts of the body could be affected. So biologically, you look at the person as a whole. You listen to what their story.
Yeah.
You listen to their emotions. You observe things moving in the body, and so you look not just as an isolated tooth, but how the whole how everything is connected.
This is
I
not
take it.
separate, right? This
No,
is not, the
exactly.
whole idea, dental insurance versus health insurance, it's a joke.
Yeah.
This is the entry portal, okay? Health starts in the mouth. It really does. And so if you're a biologic dentist, you're a holistic dentist, you simply don't put toxins in the mouth, number one. We don't use mercury. We don't use known toxic materials that are in plastics. We use zirconia instead of titanium for dental implants. We use strong precautions when we work on you to not poison you with the materials that we're taking out of your body. We use a smart protocol for removing mercury fillings, safe mercury removal protocols, okay? And that means isolating the toxins from the body, cutting around the filling instead of pulverizing the filling, taking the filling out in one piece, putting it into a hazardous material bag, because we have to, and then putting chlorella into the tooth. to pull out all the
The
toxins
heavy
that are
mercury. Yeah.
yeah, chlorella mixed with ozone water. Kill the bacteria, pull out the heavy metal toxins. Now we have a healthy tooth. Then we rebuild that with something that is biologically compatible, not poison.
So how do you put chlorella in the tooth? Is it literally chlorella powder mixed with something?
Yep, we mix the chlorella powder with ozone water,
Yeah.
and we create a paste.
Okay.
We have it isolated with a rubber shield. We put it into the tooth. We wait 3 to 5 minutes. Then we wash it out. All the heavy metals get washed out, suctioned out.
It happens that quickly.
Happens that quickly. Millions of tubes, right?
Uh-huh.
We use those tubules to bond, to stick to the tooth. But the tubules are filled with mercury and with all the byproducts of all the bacteria. We want to get that out. So we kill it with ozone water, all the bacteria. And then we pull out all the heavy metal toxins. And then we put a healthy filling in the tooth. It doesn't take but an extra 3 minutes. Why would we not do that? Right? And then we give the patient a pre and post-op protocol to try to further detox the body, right? And there's many different ones, they all work, but chlorella is easy, it's cheap.
Yep.
Everybody has it. It doesn't overwhelm the body. So 12 chlorella tablets at night make wonders, for moving mercury toxicity. So that's just mercury. We don't use metal in root replacements. We don't use titanium.
Because the body naturally doesn't have metal.
Titanium is not biocompatible. It's only biocompatible because it's coated in a layer of ceramic. People think titanium implants are biocompatible. No, the titanium isn't. It's the coating on the implant. The coating is ceramic. So we use an entire ceramic implant. 100% compatible. It looks better. It's white versus being dark. The blood flows around like a normal tooth. It loves the ceramic. It grows into the ceramic. So we use ceramic. Ceramic is less than 1% of the dental market in the United States. Think about that.
Interesting. Wow.
So biologic dentistry is new.
Yeah.
We're still introducing it. In Europe, it's way advanced. But here, we're still doing 99% titanium. Why? Cheaper, quicker, you know how to do it. It's just like teaching an old dog new tricks. They don't want to learn. And it's a business. They don't care.
Yeah.
So if they really cared and they did the research, they would use zirconia. So that's frustrating. We use ozone instead of chemical mouthwashes. Ozone is a wonderful way to kill bacteria. When we
Exactly.
yeah, it works great. And
Yeah.
the reason you don't see it everywhere is because it turns into air and water. You can't sell it on the shelf as a mouthwash.
No.
So you can't make any money off of it, right?
That's true.
It's not a pharmaceutical product.
Yeah.
You have to make it fresh. So
Yeah.
of course they're not going to like that. It's not a pill. It's not a mouthwash. So we use fresh ozone water with every patient. So when you have a tooth removed, and if you don't do it biologically, meaning we don't prepare the body, we don't make sure that you are ready to have this performed. If your immune system is compromised, if your vitamin D levels are below 60, you're not going to heal.
No.
You're not going to heal. And if you don't heal, the bacteria that's left in the socket when you remove the tooth win. They create a beautiful little nest that then gets covered up by tissue, and now you have a permanent bacterial nest in your body.
Wow.
That's not a good thing. That's
No,
terrible. That's
no.
called decapitation.
Yeah.
So we make sure you're healthy enough to have procedure done. We give you certain vitamins and supplements beforehand to boost your health. We make sure that when you have it done, you do the same thing. We do an IV. Vitamin C, glutathione, magnesium.
Is that right? You do all that.
So you get
Wow.
an IV
Wow.
to boost the health of the body immediately.
Yep.
Because all this stuff is going into the bloodstream.
Yep.
So your bloodstream is covered. We do the procedure atraumatically. We don't use a ton of anesthetic. We just use it in the right place, right? Because you need blood flow for the procedure to heal. So we use just enough anesthetic where you don't feel a thing, but your body can heal. Then, once we take out the infected tooth, we clean it with ozone water,
Correct.
ozone gas. Then we draw blood. We use your own blood and we spin out the healing proteins
Okay.
called PRP, platelet-rich plasma,
Plasma.
or platelet-rich fiber. And that is almost like a supercharged healing part for your body. Put that
Correct.
into the socket,
It's your
and
own.
now your body has everything it needs to perfectly heal without bacteria or viruses or whatever they may be, and you end up with a good result.
Yeah.
The next day, you take it easy. You do another protocol. You maybe get a lymph massage. You do another IV. So we support the body for healing. So when you do a biologic extraction, you are not just pulling the tooth, because often when I see patients who had that done, I have to fix it. To go in the bone, I have to clean out the infection. I have to put them on the same protocol. I have to pull the same healing proteins out of the blood. I have to put it back into that socket. Or you get chronic inflammation. What's chronic inflammation? The root cause of all disease.
Exactly.
So biologic dentists just do everything in that kind of format. Prevention, no toxic chemicals, make sure you're healthy enough, and the most important part, we find the root cause. If I can't find the root cause of what's going on,
No pun intended.
I'm not. Yeah, no pun intended. It's actually great. Yeah, we find the root cause. We remove the root cause.
Yeah, that's right.
If I can't find out why something is wrong, how can I fix it? I can't.
So the mouth will tell you a lot, but also, and an X-ray, the 3D X-ray that you take, tells you even more. But then listening to the patient is part of the protocol.
It's required. I work for the patient.
Yeah.
They hire me to help them find what's going on in their life. Too many patients tell me they're intimidated by the dentist or the doctor telling them what they need to do. No, you are my boss. Okay, I work for you. Make that very clear.
Yeah.
This is a very specific relationship. If I can serve you correctly, if I can fix what you're coming here for me to fix, I'm not going to just do random dentistry
Yeah.
to make money. I'm here to make you feel better and get healthier so you can get away from me as soon as possible, because we both know you don't like to be here.
Yeah.
And live your life on your terms.
Having white and straight teeth has been something promoted in the United States, I would say, before countries in Europe. I never had braces. My sisters never did. We never focused that much on teeth. But over here, when you're 14, 15, they're
It's
looking
huge.
at it. But now I also understand it is nice to have white and straight teeth, but which is very important, in my opinion, for overall health to begin with.
Yeah, for
But that is still not a guarantee. That is only part of that's maybe the visual is nice, but it is only part of the story.
Well, coincidentally, cosmetic dentistry was my forte for most of my career. I was accredited with the American Academy of Cosmetic Dentistry
Well, my
in
understanding is
2007.
you're one of the best in the world.
One of the best in the world, yes. I was on TLC, the Learning
Yeah,
Channel, Extreme
yeah.
Smile Makeover.
You educated other dentists how to do it.
Oh, yeah, I was a KOL, key opinion leader for cosmetic dentistry for 10, 15 years. And I enjoyed making people look good. I mean, the emotional component of dentistry is amazing. If you don't feel good about your smile, you really can't live a completely fulfilled life, right?
Totally.
So
Totally.
I've done more veneers than I can count. I've done more smile makeovers, etc., than probably most dentists will ever do. But I did it in a more biologic way. So you can do cosmetic dentistry by cutting teeth down to a little nub. Everybody's heard about that, right?
Yeah.
Just veneers, you just cut, and then you're stuck with it for the rest of your life. Because at some point that needs to be redone. And it's going to cost a lot of money. You may not be in the same financial situation, and people run into problems.
Yeah.
So we did a lot of smile makeovers without cutting teeth. Looks amazing, but requires a little bit more technique, a little bit more skill, and it requires an amazing technician. Equals more money, right? Because the technicians are expensive.
Sure.
So, but you're not causing more harm than good. We worked hard at creating a functional bite. If your mouth doesn't function correctly, doesn't matter how good it looks, you're going to get joint problems, which are not reversible at some point,
Right.
and major issues. So we did a lot of TMJ management. We do a lot of expansion of the arches to maintain or repair the airway. That's big right now, airway dentistry, because people don't understand that a lot of illness is tied to poor airway, right? You just don't have enough room for the tongue. Tongue falls back, closes up the airway at night. Doctor's solution, CPAP, pump them full with oxygen, right? It's just ridiculous. It's the root cause, right?
Yeah.
If there's an airway issue, fix the airway issue. Doesn't always work, but works on most people.
Yeah.
So cosmetic dentistry was my forte, and everything I do, I think, should be cosmetic. It always should look good.
Yeah, just
mean-
when you have a carpenter building your house,
I
you
want a
don't want it to be
cosmetic carpenter.
crooked. You want a cosmetic carpenter. That's right.
I want an ugly house that functions really well.
Yeah, exactly.
No, cosmetic dentistry should be the norm. Biologic dentistry should be the norm.
Yeah.
The fact that we have to fight for doing the right thing for people in the mouth is ridiculous. The fact that we have to not cut teeth down to little tiny nubs to make you look good is stupid. We should have the training, the foresight, the understanding to do no harm in all ways to the body.
Yeah.
And that goes on food industry, the pharma industry, the dental industry, the medical industry, the work-life balance in this country. It's all a battle for health.
Well, and it's also you are introducing your patients to a specific diet and lifestyle to encourage that. It's called the BOSS diet, BOSS.
Yes.
Can you tell us a little bit about what brought this about?
So I had many different protocols to make people feel better. They were all too complicated. If something is too complicated, even for me, I just won't do it. I'll fall off the bandwagon. It's too difficult. It's hard to introduce healthy habits.
Correct.
Telling somebody to go work out for an hour or two a day, follow all these exercises, this is exactly, how you have to eat, count your carbs, your macros. It's not going to happen.
No.
Okay? You're not going to help very many people. You're going to help that 0.1% that is obsessed.
Correct.
But the problem is with the 99.9% of people that we need to help. So my goal was to simplify optimal health. So how do I simplify optimal health for the 99%? And so I tried to create a protocol that is very easy and super highly effective. Doesn't require $1 million worth of supplements. Doesn't require an extremely strict exercise schedule. Doesn't require for you to be an expert in macros for your specific keto diet, whatever.
Yeah.
So I call it the BOSS diet because it's BOSS, Biome Optimizing Super Strains. So it's all about your bacteria. So I started with the end in mind. How do I repair the body? I only repair the body when the body is at rest. How do I get the body to rest? Well, I need to have the body shut down. How do I shut the body down? Well, I stop digesting. How do I stop digesting? Well, I create an empty digestive tract. So that was the first thought. Then I'm like, okay, so how do I accomplish that? Well, red meat takes 3 days to digest. White meat, fish, things like that. I'm sorry. White meat includes pork and chicken and turkey. Takes 2 days to digest. And then there is fish. Fish takes 1 day to digest. And then vegetables and things like that take 4 to 6 hours to digest.
What about eggs?
Eggs, anytime. It's like 4 to 6 hours. It goes fast.
Oh, good.
So eggs any day. So I created a Monday through Friday protocol. Monday, red meat, 3 days. Tuesday, Wednesday, white meat. Thursday, fish. Friday, vegetables. Friday night, empty digestive tract. That means that your body can shut down. You can do a real fast, meaning your body can actually repair. When the body is not working on digesting, which takes 70% of the immune system and most of your energy and blood, it now can spend that energy on autophagy. Going in there and taking off the bad cells, cleaning out the bad stuff in your digestive tract, killing all the bad bacteria, rebuilding, right? That takes 14, 16, 19 hours. So Friday night, digestive system is empty. Now you fast, a true fast, overnight, 14, 16 hours.
So the vegetables go pretty quickly. So then you do, by the time you go to bed, much of that has been already digested.
Should be done.
Okay.
So at that point, you are getting a true fast. Intermittent fasting doesn't work. Not the way people want it to. It helps a little bit, but the system's on, right? If your car is always running, you can't fix it. If your car is running consistently, you can take it through a car wash, right? The outside. You're driving through the car wash, which is great, and that makes it look pretty.
Yeah.
But it's not being detailed. You're not changing the oil. You're not changing the fluids.
No, you got to turn the car off for that.
None of that, exactly. The car needs to be off.
Yeah.
Your body's the same way. Intermittent fasting, when you eat meat all the time, doesn't turn the car off. So you're just getting a car wash on the outside. And cumulatively speaking, chronic inflammation, right? Your gut is a wonderful source of chronic inflammation. And if you don't turn the gut off and detail it, then you're going to have a major problem. So, yeah, you can fast. You can take a 3-day fast or a 5-day fast or do a water fast or,
Yeah.
that's hard. That's the 0.1% again.
Yeah.
99% of people are not going to do that. But a lot of people can eat a certain way most of the time and then have a weekly true detail. Do you know cumulatively how beneficial that is for your body? Cumulatively speaking, if you do a weekly fast that actually details
Like
your
you're
body,
talking about.
exactly like the Boss diet, you're going to end up with an insanely healthy body. And then you're going to be able to fight harder. Your immune system is going to be stronger. While we are doing this protocol, the Boss diet, I actually call it the hazmat human reset because I'm taking somebody
Say
from
it again, the
the
what?
hazmat human reset.
Okay.
Because you're a Superfund site. You're a hazmat human. You've been
Yeah.
poisoned. Okay, that doesn't clean up unless you actually do a detail. So when you do a 66-day detail, a 66-day protocol, specifically designed to introduce different levels of detox when they are appropriate, different levels of cleaning, to first heal the mitochondria, the energy cells of your body that are being destroyed.
Correct.
Then to multiply the mitochondria. Then to feed the mitochondria to get your energy back, right? Then to detox properly. Then to create the right diet habits, the right foods, fermented foods, vegetables, 30 plus plant species, the right meats. It's all lined up so that it's easy and simple to do. Very low thinking involved. And that is my answer to try to not just go in there and band-aid people all day long, but to give them a path to optimal health. That is as simple as I can possibly make it.
Is the response pretty good from your patients on this?
The protocol is new because I'm actually putting it into writing, but
Yeah.
I've been using it on patients
Yeah.
for years.
Okay.
And it's really, I feel, the only way to actually get people to heal. The only way to make people better is to give them a solution they can implement, to simplify. And it can be very expensive. I mean, tens of thousands of dollars for these protocols. Very few people can do that.
Yeah.
$1,000 of supplements a month is difficult. I used to do that. I used to
agree.
take thousands of dollars. I used to do it for 6 people in my family.
Yeah.
That's too much.
Yeah.
I'm thinking, even for me, I can't sustain this. My body should be able to, on its own, be healthy. Why do I need all these extra things? Well, on a long-term basis, I don't want to be on all these supplements. I want to fix what's wrong,
Yeah.
take the right supplement or detox to get there, then fix the reason why I got there in the first place, and then taper down the supplements and live a life of optimal health based on diet and lifestyle.
Correct. I always say supplements are there to supplement your diet and
That's
lifestyle.
very good.
Right. I also see that in the supplement industry, because there are so many different companies anymore who make products and put a label on it, we have patients, we have customers who will tell you that they don't see any effect from the supplement that they were using. And then I just simply say, usually I tell people, do enough for a month. If you don't notice anything in a month, 20%, 30%, it's maybe not your product. Then do another company. Do the same thing, but do another company and see if that works differently.
Weird, right?
Do a lick, yeah. And but that is why people say, "What is your best company?" And I have to say, I don't know, because
always
I don't know
changing.
how your body reacts to it, and what exactly you're looking for. And I also have learned that taking more is not always better. You know, case in point, just this week I learned, and that is something that I didn't know, but somebody came in with, he's been developing neuropathy in his feet. And I did ask him if he had the COVID shot, and he said no.
Oh, good, good.
But his wife had 1 or 2 shots, and she regrets it now. But you know, you live together, you could get affected by it. So I thought there could be a link, because I've heard other people have an effect. We made some suggestions, but then he was forwarded to a neurologist, and she said, "Do you take vitamins?" And he said, "Oh yeah, I take vitamins." Almost like,
Of course I do. Yeah.
"Yeah, I take vitamins," really proud. And then she asked him to explain the vitamins that he was taking, and she came to the conclusion that he may be taking too much vitamin B6. And I never knew that B6, now in some books they say if you take over 1,000 milligrams a day, that may actually affect the neurological system and could cause neuropathy. He was taking a little over 100 milligram, and then I saw another book that was saying for some people 100 milligram would be too much. So the interesting thing is he decided to quit taking anything that had a B vitamin in it, B6. And within 2 days, so his pain was so bad he could function during the day, but at night he couldn't sleep because his feet were just throbbing. And so within 2 days, the
Wow.
pain is diminishing. And he told me, he said, the funny thing is when I started having this problem, I thought maybe I need more vitamins,
Wow. Yeah.
right? And then in his case, he is already feeling better within
Wow.
3, 4 days. So I said too, I didn't even know this. This is good information because I've talked to other people with neuropathy in the toes. And what if they are taking high B6? Doesn't mean you shouldn't take B6. It's got many benefits.
It's
But
crazy, right?
yeah,
I mean, you are way more knowledge than 99%, way more knowledge than me with supplements. But a supplement is a drug. A supplement has to be metabolized just like anything else. A supplement goes through the liver, through the kidney. It has to be absorbed. So this is a good example for like doTERRA or for oils.
Yeah.
People take these oils. I'm like, these oils are very concentrated
yeah,
parts of a plant that was medicinal.
Yeah.
You're taking something that worked wonderfully and then you're Xing it 1,000-fold. That may not be beneficial.
yeah,
It could be dangerous. So my solution was find out what the root cause is, again, remove the chronic infections in the mouth that
Yeah.
cannot be treated by anything other than a biologic dentist.
correct.
Then address the root cause of why these teeth died in the first place. Is it habits? Is it diet? Is it whatever it may be? And then rebuild your body in a way that you can maintain it, like the Hazmat Human Reset, and then following the BOSS diet for how you eat, and then supplementing minimally based on things that come up. And I'm a big fan of rotating supplements. I feel that if something is wrong and I take a supplement for it, I take it for a month and then I switch on purpose. And I do this for dental products as well. I don't use the same toothpaste every month because I don't know if the ingredients, good or bad, are going to be okay for my body. So I switch it to a different healthy brand, and I rotate 2 or 3 different versions all the time. And I think if we follow that protocol, we're not going to be doing something that could be terribly bad for us on a consistent basis because we're always rotating.
Yeah.
So that has worked really well for me and for patients who had no answer.
I do want to bring it up. You've been talking about mercury. How about fluoride? And
The
why it works-
neurotoxin?
So maybe, what is it, 12 years ago? I think the Bozeman City Commission in this town decided that all the evidence pointed that people would benefit more from having fluoride in the water. In comparison to cities like Paris or Amsterdam or London, New York, they had all decided no fluoride in the water.
Yep.
And it is, to me, the kind of fluoride we're talking about, and maybe you can help educate our listeners here, viewers. This is not the fluoride or the fluorine that Mother Nature makes. This is a chemical compound,
Toxic byproduct.
toxic byproduct. And I remember one of the professors, one of the doctors, dear friend of mine at MSU, who was in front of the city commission and said, the fluoride that is used in the toothpaste, for example, when it mixes with the hydrochloric acid of the stomach, it creates a whole new beast that starts affecting the rest of the body. And he said, I look under the microscopes. I'm a chemist. He's a biochemist, biochemistry. And not even his testimonial about what he literally saw happening was enough to deter the city commission, they said, after listening to everybody. And all the dentists in town, except one biological dentist who we have here, besides you before you came, was there sitting with me. But
Yeah.
all the other dentists and dental assistants were all wearing a big button that they felt fluoride had to be part of the water in this city, because it's not about the city next door doesn't do fluoride.
No.
Can you educate us about fluoride, the good and the bad?
And the ugly, yeah. So to simplify things so that we can actually understand common sense things about fluoride. If we look at their argument of decay, protecting from decay, the United States fluoridates in general, and Europe doesn't. We have many decades of studies. There's no difference in decay rate between the United States and Europe.
Okay.
So the fluoridation has no positive impact on decay rates with large studies. So that's just common sense, right? It's not really working, so what do we do about that? Large studies show that, no, it doesn't really make much difference for decay in big populations. Number two, so what do we have study-wise on fluoride? Well, we used to have rules, right? You can only have so much fluoride per day. That was like the dental stance. Well, you're only getting a fluoride treatment, which is going to be, 100% of your fluoride for the day. Or, they're only using a fluoride toothpaste, which is 10% of the fluoride you can have during the day. The reality is you drink fluoride all day, you brush your teeth with fluoride, you get fluoride treatments at the dentist, you have fluoride in the sodas you're drinking, fluoride. The levels that even the ADA set for safety in fluoride were easily exceeded in a normal life. And then the dentist just, destroys that level by putting fluoride in people's mouths. So the levels of fluoride safety were not even possible, even if we tried. The cherry on top is that we did a retroactive study, a cumulative review of studies for fluoride a couple years ago.
Okay.
And the result was, down here in the United States, there is no safe level of fluoride. Zero. The studies made it very clear that there is a clear link to lower IQ in your children if you have fluoride exposure. Who wants that? Very clear link. If that is not enough for somebody to question the reason to use fluoride, again, we can't help those people. No big difference in decay, lower IQ, and it's a neurotoxin, nerve toxin for the brain.
Yeah.
So Europe banned it. Europe is very clear on fluoride and mercury because it's toxic. We here...
But they still sell toothpaste with fluoride in it.
Unfortunately, a little bit, yes, they do. But I don't think anybody was in the right mind is going to start using it as much as they do over here. Okay. Over here, fluoride is touted as the solution, right? When I see fluoride in people's mouths, we see something called fluorosis. Too much fluoride, which is easy to do. White spots all over your teeth.
Yeah.
Those white spots turn into brown spots very quickly because it's chalk. That chalky surface on your teeth turns into brown decay spots all around your teeth in your entire mouth. When that happens, which is very common, there's very little any dentist can do. You can't remineralize that. You can't put fillings all around the teeth. You are stuck with dental problems for the rest of your life.
This is not surface stuff. This is actually gone into the tooth now.
It's on the enamel. The surface of the tooth is the enamel.
It's
the
on
hard
top,
stuff.
it's
It's
on
like your
top of
shield.
it.
It's on the top of the enamel. It changes the enamel. So you have what's called a hydroxyapatite crystal.
Correct.
That is your tooth structure. That is changed to a fluoroapatite crystal. When fluoride chemically combines with the outside layer of your tooth, it changes the crystal. That crystal structure at first is more decay resistant, but it's also brittle. Brittle doesn't work in the mouth because your teeth flex, like we talked about, amalgam.
Yeah.
When your teeth flex at the gum line, where the teeth touch the gums, at the gum line, that flexure breaks the crystals. Those broken crystals now create millions of little channels for bacteria to get in behind the fluoroapatite.
I see.
Now they're into the second layer of the tooth, the dentin, which is 50% organic almost. And that is food for everything. It dissolves very quickly. The dentin holds the outside layer of the tooth. When the dentin, the second layer of your tooth, gets compromised because of this bacteria that leaked in, bacteria releases acid. Yeah. Acid breaks it down. Then the fluoroapatite crystal breaks off. And you see people who have the white spots just chip off. Underneath it is a big brown spot. That brown spot is the decayed second layer. Dentin. Highly organic, very difficult to fix. Nothing bonds very well to it. And it's not just the outside of the tooth, it's 360 degrees. It's circumferential around the tooth. Think about that.
Wow.
Between the teeth, the same thing is happening. How do we fix that? Well, we have to drill all around your tooth. And even if we do that, that's a crown, right? That's a cap to drill all around the tooth.
Because you create,
you have to, because we can't reach it.
Yeah.
So how is that a benefit? Short-term benefit, long-term disaster for patients. We see that all the time. So no, we haven't used fluoride. We don't use fluoride. Is in fillings. Did you know that?
I did not.
The dental fillings release fluoride. The vast majority.
The dental fillings.
The dental fillings release fluoride.
Fluoride.
The plastic
not
white film.
What's the difference between fluoride and fluorine? The fluorine, is that the natural occurring mineral?
Well, just like anything, if it's natural, it's probably fine because nature doesn't create things that are toxic. So when we take a singular fluoride ion, whatever it is.
But this is now coming out of toothpaste, or this is now coming into the body.
It's leaving this
fluoride.
filling.
So every time you talk about fluoride, you talk about something that enters our body from the outside.
Yes, exactly. It's on the outside, right? It's in the filling. Exactly.
Correct.
It's going to go in. You're going to swallow it. It's going to go to your stomach. It's going to create the toxic element.
Yeah.
For sure. But we're just talking about they're using it because the thought was the release of fluoride hardens the edge of the filling, which is the enamel or the outside of the tooth.
Correct.
And creates less decay, which in theory was a good idea. But then we know that is a very brittle tooth structure, which then will break off and create a bigger hole for bacteria to get in. So it's negative. So we use non-fluoride fillings. Biologic dentists don't use fluoride, right? So we have to specifically use German materials which have no fluoride in them.
Huh.
It's harder to find than you think. Wow. The cements we use, the glues, all fluoride releasing. Like all of them. 99% of the filling materials are fluoride. 99% of the cements, the glues, the adhesives, fluoride.
So
you get fluoride everywhere in this country. So the review of studies made it very clear, no safe level of fluoride, and you can't get away from it. So if a biologic dentist, who should be aware of this, is going to import materials, import glues, use different things. And this is why for biologic, we look out for your biology. We don't use things that are not going to be good for your body.
Incredible.
Yeah, and it's ridiculous. It's what it is, because it's not any more difficult for me to use this material that's healthy than that material that is not healthy.
If you start fluoride at a young age, and which happens because parents tell kids brush your teeth and they give them fluoride toothpaste, how quickly do you notice the decay starting of the dentin and of the enamel versus somebody at an older age starting with that process?
So I can't really tell, unfortunately, but what I can tell you is this. The fluoride that we use in older people is not necessarily as detrimental because we have a shorter lifespan left. We're looking just to quickly harden something. Let's say somebody can't brush their teeth. Okay,
yeah, it's possible.
They're in their 80s and they have rampant decay. Yes, fluoride or hydroxyapatite, which we can buy now as well, will harden that tooth structure temporarily. That's maybe all they need. So that's like the only time where something like that is beneficial. And kids, why would you set somebody up with a permanent change of their tooth structure that they have to live with for 80 years before they should even have problems?
Yeah.
Plus, I forgot to mention it calcifies your pineal gland. So I'm a spiritualist. I believe pineal gland is your connection to higher self. You know, the pineal gland is very important for many reasons. We do not want to use fluoride. there's better options. Hydroxyapatite, for instance. If we are adding a hydroxyapatite crystal, which is much more similar to our actual tooth structure, then we're creating the same result.
Is it like a
without that.
calcium?
It's like calcium, but calcium doesn't.
Because we have at the store we have a calcium hydroxyapatite, and I thought it was made from the bones of calves.
I don't know how they make it.
Okay,
But the hydroxyapatite crystal,
I heard it's really well absorbed. It's a good absorbable form of calcium.
true, but the problem is that there's two versions.
Okay,
There's the micro size and the nano size.
okay.
Nothing nano has ever worked out well for humanity.
Really?
Think about this. Nano is too small for your immune system to deal with. So nanoparticles bypass all your defenses. They go right between your cells. Nanoparticles are too small. Micro is dramatically bigger, but still very small. Micro hydroxyapatite works great on teeth. The micro-sized crystal cannot damage your cells.
It's called microcrystalline hydroxyapatite.
Then you're good.
Must be the good one.
That's the good one. So nano, I had to take down a video that I did on nano hydroxyapatite.
Yeah.
Because a specific company out there got upset that I didn't like it. And I have no interest in lowering up against these billion-dollar companies.
Yeah.
So the reality is, though, there's, I think, two specific shapes of nanocrystals they allow to be used in toothpaste, nanohydroxyapatite. Why? Because if they're not exactly round, if they have a little point to them or they're too long, they become like fiberglass in your body. So you have to follow incredibly specific design rules for nanohydroxyapatite to theoretically not be harmful. Now you tell me that all these companies out there that are going to make millions of toothpaste to add nanohydroxyapatite are all going to have the perfect, very specific nano-shaped particle in it, and none of the bad ones that could harm you.
Wow.
I'm not taking that risk.
Wow.
No, it's
Wow.
not going to happen. So just go with micro. Follow a proper diet. If you are having decay issues, I promise you, hydroxyapatite is not going to fix your problem. If you don't figure out why it happened, you can lather your teeth with miracle juice and they're still going to decay.
Yeah.
Figure out the pH of your body. Okay. Figure out your biome.
Yeah.
Use something. There's many probiotics, like Biotics, which I make. Many probiotics, oral probiotics that you chew, that crowds out the bad bacteria of your mouth, the acid-producing ones, right? So if I add a whole bunch of good guys in your mouth, the bad guys are going to be crowded out because
You bet. There's only so much room.
so much room.
Yeah.
The good guys don't release as bad of an acid. Acid is what causes decay.
Yeah.
It's not bacteria eating your teeth. Bacteria cannot eat teeth.
No.
They release acid. You just feed them. So if we give you the bacteria that doesn't release the acid that's strong enough to cause decay, you're not going to get decay. So we change the biome of the mouth, the reason behind decay. This biome feeds this biome.
Correct.
So as I'm swallowing hundreds of millions of bacteria every day, if I have a really good oral biome, I'm going to get a really good gut biome.
Yeah.
But if I'm just taking oral gut probiotics, it's never fixing the source. It doesn't travel this way very well. It's all going this way. We start here, fertilize the body with good oral biome, then turns to a gut biome. And the gut biome, then we feed it what that likes, which is fermented foods.
So what is specific about the oral biome from Biotics?
There's literally 30,000 different types of different bacteria that we know of at this point. There's 6 in there.
Correct.
And the reason we put 6 in there is because those are the actual researched ones that make a tremendous difference in the mouth and the nasopharynx.
I see.
L. reuteri, Lactobacillus salivarius. These are the ones that we know and have research on that are good and that don't do any harm. Because we don't want to experiment on patients, right?
No.
Right. So I'm using something that is very well known, and it's like the Navy SEALs. I put in the Navy SEALs, they clean up the area, and then you are responsible for eating a diet that feeds the right biome, a fermented food diet. This is why BOS Biotics, Biome Optimizing Super Strain Probiotics, and BOS Diet, right?
Yeah.
Biome Optimizing Super Strains Diet. We give you the Navy SEALs, we give you the diet to feed the guys. Together, we make it so that you can build the perfect biome. And then we put you on a rotation, a protein rotation diet, so that you can heal every single week and clean up the damage that was there, the war scene, right?
Correct.
So just like a war, you're going there, you send the Navy SEALs, you take out the leader. Now
Yeah.
you got all these other things you got to clean up. We shut down the country, we clean up the country,
Yeah.
we put in the good guys, and voila, you have a functional biome,
Biome.
oral
which
biome.
is-
It's the same thing.
Yeah. Yeah.
So it
yeah.
really works. It's very simple.
It's incredible. It's indeed a whole system that you have learned some of it with trial and error yourself.
So I'll try. Everything
know?
is experimented on me.
Yeah.
Yeah, before. If I have something that I use, it's been with me for years before.
And I'm sure the response you get from many of your patients, and as you look into the mouth, you can see that the inflammation is disappearing.
If I
and
don't
the
see results,
infections.
I change it. Yeah. If I don't see it working the way it needs to be, I change it. So when I work with people, for instance, let's say you wanted to go through the protocol.
Yeah.
I guarantee that your health markers will get better in 66 days. We do an HSCRP test.
Yeah. High sensitivity, C-reactive protein.
There you go. We do an HSCRP
Yeah.
test before and after.
Yeah.
And if you are not
What do you
getting
mean
better,
after? How long after?
66 days.
66 days. Okay.
If I don't see an improvement with what we're doing with you, then I will work with you for free, one-on-one, till you do.
Wow.
Because it's required in my belief system that I do good for you.
Do you notice, therefore, that many people have elevated HSCRP?
Chronic inflammation.
Right.
Yeah, most people over 3.
Yeah.
If we're looking at 3 being like the cutoff.
Correct.
So most people are high.
Because I talk to people and I have them bring their blood work, and I'm surprised how many people have issues and they have their CRP is low.
Well, we do
Like, whoa.
HSCRP, we do organic acids, we
Yes.
do a total tox panel,
You bet.
we do we give an optional gut zoomer and a wheat zoomer and vitamin D3 test. So we do a lot of different things, but the easiest one is just a quick little inflammation test.
Correct. Correct.
But we need to see, what's your problem? Where's your issue? The total tox panel by like Vibrant Wellness is great. We check for bacterial toxins, endotoxins. We check for mycotoxins and environmental toxins, heavy metal toxins. We got to see where your problem is. If I don't know what your problem is, how can I fix it? Right. So I take testing before. I put you through the protocol, which requires you seeing a biologic dentist,
Yeah.
not just me. And then 66 days later, we test again. You should, and you know why it's 66 days?
No.
Habit. I need you to be on the right habits. I want you to develop the habit of eating correctly. I need 66 days to rebuild the mitochondria of your mouth, of your body.
Yeah.
I need to rebuild the energy source of your body so you can feed your immune system.
So you do what you can. You expect the patient to do what they can, and then see how the results.
Yeah,
are
and if you
working.
did your part and I did my part and you didn't get any better, I'm going to work with you till you do.
Yeah.
Because I want you to get better. This is not, it's not for fun. This is a life change.
We're coming to the end of the program, but I would like to ask you to help us out a little bit on your book, because you wrote a book, Unbox Yourself,
Yes.
and I haven't read it yet. I just browsed through it. It's enticing because this is your story, but you share your story with other people. So I see indeed you can't tell on the outside what is inside the package. You're going to have to unwrap it. You're going to have to unbox it. You're going to have to find out what's really going on inside. And this is not just the physical, but this is indeed the spirit and the mind and the emotions as well. And this is kind of your journey that you've gone through.
I wrote that in 2018 when I quit dentistry the first time as a actual practitioner. And here's what happened. After seeing patient after patient and just focusing highly on making people look better, I was a high-level cosmetic dentist, and implementing natural biologic principles, but not making the health part priority. I mean, it was just who I was. I didn't consider biologic dentistry unique. I figured everybody should be doing biologic dentistry. So I was the cosmetic dentist. And by 2018, I had burnt out in cosmetic dentistry. I have decided that I just don't want to cut another tooth. And I said, I've seen so many people who come to me who are rich and famous and miserable. I've done so many smile makeovers for people who look for a smile to fix their problems, right?
Correct.
Their health. And I have endless stories of almost billionaires telling me, I worked really hard, I built this business, and now I'm alone.
Yeah.
I have nobody. My family doesn't want to talk to me. My health is terrible. I have all the money in the world, but I'm unhappy.
Yeah.
And in that book is a story as well from when I was just out of dental school. And I sat at the table of the who's who in cosmetic dentistry, the who's who. Literally the A-list.
Yeah.
And I was excited at this wedding to listen to these people tell me how much they loved what they did and etc. You know what the stories were? Oh, I wish I just want to do photography. I would like to be a photographer. I'm on my second divorce. I had a heart attack. I can't stand the stress. I'm just not happy. I really don't like what I'm doing. This is the people that are teaching everybody else how to do what we do.
Yeah.
So I took note, and that's when I started teaching biodentistry. I started to go to the little groups and saying that focus on your health, focus on your happiness. So the book that I wrote was literally my prescription on how to live a life of freedom. Freedom of time,
Yeah.
money, and location. Different for everybody. I wanted to be able to do what I want when I want and not end up like one of those people,
Correct.
rich and unhappy and sick.
Yeah.
So we focus on health, we focus on mindset, and I took a year off, went to Oregon, and took the family. All we did is go hike and spend time in nature and decide what do we want to do. When I came back to dentistry, it was purely to help people get healthy so they don't end up in the same problem that my patients ended up
Yeah.
as the end of all cosmetic dentistry. Get veneers, get a new smile.
Wow.
Not the solution. So I wrote the book. There's some interesting points in it, all the stories we talked about, and then some.
Yeah, they're nice. Those short chapters, they're really
Quick,
concise.
easy to read,
Yeah.
and it has what I call the success equation in it. I won't give it away. You have to read the book. to
No,
get
no,
it,
no. I understand. How do people get the book? Do you go to settlepeakdental.com or is it
It's on Amazon.
Amazon? Okay.
Yeah, it's also on. If you go to any of the websites I own, bossoralhealth.com,
Okay.
thedetoxdentist.com, and Saddle Peak Dental better have it as well. You can come to the office
I
and
think
buy it.
I think I saw a few copies.
Yeah, you're
over
gonna
there.
get it in the office.
Well, it's been an absolute pleasure, and what an education that I have received today, simply from listening to how you explain it and what you explained and how you link it all together. And it is something that I never heard it that way, and I hope that most of our viewers will say, this is a whole new avenue that I've never explored, but now I start to see the benefits or the need of all health and how it is all connected with the body and the mind and the spirit.
It
If
is.
you talk about the pineal gland being blocked, and that is your connection with a higher being, higher spirit, whatever you want to call it, and how you want to work with it, that is huge.
That's your
Life,
higher
there is
self.
no reason for life if there is no spirit, in my opinion.
Yeah, we could talk about that for another 3 hours.
Yeah.
Yeah. No, you are a spiritual being having a human experience, right?
Correct. Correct.
And to simplify the human health experience so you can focus on the spiritual experience you're supposed to have in this world is kind of my goal. And I hope I don't overcomplicate things. I try to be simple because we help more people when they can implement simple changes in their life that make measurable improvements in their health.
Correct.
And that's all I do now is try to simplify optimal health for people. And in my opinion, that starts in the mouth.
Right, and when you simplify it, those are little bits of information that's easy to remember. And so when you get stuck, you remember the short, simple instructions and education that you provide. It's fantastic. I do hope all of you that you enjoyed this video, that you start looking more into biological dentistry, that you go to Saddle Peak Dental and read more about Dr. Hahn's story, Dr. Chris, And also the Detox Dentist, is that the website?
That's my YouTube. I started a YouTube channel to try to simplify optimal health for people, and I call it the Detox Dentist because it's easy to remember.
Perfect. The Detox Dentist. Hopefully you check it out. Thank you for all the time you gave us today to listen to this podcast. I do hope to see you again on another episode of Health in Focus with Jacobus, and I wish you all a wonderful day. Thanks for your time. Appreciate you.
Oh, appreciate you. Thank you.
Visit healthinfocusnow.com.